All right. Good evening, everyone, and welcome to the Northwestern Melbourne Primary Health Network session on COVID monitor and supporting you to manage COVID positive patients in the community. My name is Claire and I'm part of the workforce development team here at the PHN and will be facilitating the session today. Before we begin, I'd like to make an acknowledgement of country. The Northwestern Melbourne Primary Health Network would like to acknowledge the peoples of the Kulin Nation as the traditional custodians of the land on which we're meeting today. We recognise their continuing connection to the land, waters and culture and would like to pay our respects to elders past, present and emerging. We do have a couple of housekeeping before we begin the session. Participants are muted for the duration of the session. However, if you do have a question that you would like to come off mute for, you can raise your hand and we will be able to unmute you. This will be at the end of the session. Alternatively, you can use the Q&A function if you do have questions. We will be monitoring that and answering them either throughout the session or at the end. This session will be recorded and all questions in chat will be kept anonymous for your privacy as well. We do ask if your name in the Zoom webinar is correct. If it is different than the one that you registered with, if you could kindly send a message to Northwestern Melbourne Education in the Zoom meeting, that will be quite useful for when we do mark attendance and we're able to mark you off. Here's a brief agenda for the evening. We do have quite a few special guests that I will introduce shortly. We'll be looking at an update on the pathway. We have some upcoming treatments that will be discussed by Dr. Smith and his team, and a demonstration of COVID monitor, which I know most of you will be looking forward to. So now I'd like to introduce the speakers and panelists for this evening. Firstly, we have Bianca Bell, who works as the Director of Primary Healthcare Improvement at the Northwestern Melbourne PHN. Bianca has over 18 years experience in the general practice sector and is currently responsible for implementing the primary care engagement strategy and workforce development programs, and has had a huge input in the COVID monitor as well. We also have Dr. Nicole Allard, who is a general practitioner working with cohealth and is the public health lead for the COVID-19 response at cohealth, and has been the lead clinician in establishment of COVID positive pathway. So also a huge involvement in that. Lastly, we do have Associate Professor Neil Smith, who is a general and respiratory physician at Werribee Mercy Hospital. He's also working at the hospital as a COVID consultant and has been providing inpatient and outpatient care to COVID patients over the last 2 years. Joining Neil, we do also have Susanna, who is the nurse unit manager, and Dr. Chi Choi as well. Welcome all, and thank you so much for being here tonight. I know everyone will really appreciate the time and information you'll be sharing. So I'll hand over to Bianca now.
Thanks, Claire, and thanks everyone for joining us on a Monday night. I know it's a bit of an ask, so thank you so much. This is the first of our introduction to COVID monitor sessions. Tonight has a bit more of a clinical focus, and then we have a session for practice managers on Wednesday. But I am going to pass the baton on to Dr. Nicole Allard, who's going to kick us off with a bit of a pathway update.
Hi everyone, and thanks for having us here this evening. Just a recent slide where we looked at achievements to date. So there's been about 34,000 referrals through the program. I actually like to say, well, I don't know if I like to say it, but there's it's about 1/6 of COVID in Australia and about 1/3 of COVID in Victoria. And through the program, we've connected people to clinical care, inpatient care, cared for at home by virtual monitoring, through hospital in the home or general practice. And we've had over 1,000 GPs in the West involved in care. And people have looked after from 2 patients up to over 100 patients. So mammoth sort of heavy lifting by general practice. And we know that from our initial data, there were quite a lot of people who actually needed support needs at home. And one of the differences or the distinguishing things about the Northwest Melbourne pathway not only has been its unique partnership with the PHN, especially Bianca and all the hospitals, but it's also been a very heavy emphasis on social supports required to isolate. And of course, everything changes over time, and we've had some recent changes with the period of isolation back to 10 days from 14 days. And we've also referred a whole lot of clients in for care navigation. Next slide. So this is the Metro pathway that you all know. And right at the bottom is data capture into Redcap. So as you well know, we've been asking many of you to fill out surveys for Redcap. And I guess we're about to move into a new stage where we're using a different platform, which has been used in the northeast and southeast of Melbourne. Their programs have been slightly different in terms of the emphasis on general practice care. So we always have had a large number of people being cared for in general practice by their regular general practitioners, as well as during this latest surge, we also had a small amount, and we continue to have a small amount of people who don't have GPs being cared for by other services, like 24/7. Okay, next slide. I think the other important thing is previously we had a risk framework classifying people as low, medium or high. And recently we've sort of added vaccination into that group. So in the original pathway back last year, we were people over 60 were considered higher risk and were put in hospital in the home. That was then dropped to 55, mainly to be consistent with other pathways across Melbourne. But now we've got a bit of a change. So people who are between 55 and 75 and they're fully vaccinated will now be referred to general practice if they have mild symptoms and not complex social needs. So for example, if we take a 60-year-old who has quite significant respiratory symptoms, he or she would still be referred into the medium clinical well, even if they were vaccinated. So it's not just about vaccination status, it's about their symptoms and always considering if there are any barriers to home isolation. In the medium category, so we've got people who aren't vaccinated over 55 with comorbidities, or if fully vaccinated with comorbidities over 75. And high essentially remains the same, which is any of the red flag symptoms at assessment, concern of shortness of breath, hemoptysis, chest pain, syncope, other clinical concerns are referred directly to inpatient care or certainly an ED assessment. I think the other thing we've got to all consider is that we've got some new testing pathways. So with the rapid tests that people can do at home, people might actually be presenting to their general practitioners and saying, well, I've done a rapid test at home and it's positive, I've got COVID. Now, obviously, rapid tests don't register with the health department. They don't register as a notification. And it is still recommended, because there are false positives, that anyone who has a positive test goes and gets a proper PCR test done, and then we'll go into the notification system. In pathways, we will accept someone who has just the rapid test positive and register them and assess them if they ring up or if a GP is worried and wants to get them into the program. But we will ask them to follow up with a PCR test. Next slide. The other thing is just previously, in fact, Bianca pointed out today, it's sort of gone backwards and forwards. So previously, pregnant women were actually looked after in general practice. And then more recently this year, we've had pregnant women all going into hospital in the home services. And now what we're looking at is the low risk pathways. So people women who are pregnant and double vaxxed and they don't have significant clinical features suggestive of sort of worse end of mild disease, will be referred back to their general practitioner with support from the health service in which they're receiving their maternity care. Now, if they're over 36 weeks, they're going to go into a different pathway because they're kind of close to that period of expected delivery and need to be managed more closely with the hospital service. I guess it's a change, but it is actually just a change back with now the protection of double vaccination. So next slide. Again, there's a risk category framework that will be on health pathways, and I encourage people to look at the health pathways specific to the North West Melbourne PHN. I was not interested. I thought it was 36 weeks. Here it's saying greater than 20 weeks gestation. Feel free to jump in and save me, Neil and Susan. But anyway, so people will be going into medium streams if they're over 20 weeks. That's strange. I spoke to Alistair before and I thought he said 36. Never mind. And then if they're over 36, they'll be seen more intensively in the medium risk pathway.
Nicole,
oh no, sorry, I am right. Yeah, no, I'm reading it wrong, aren't I? There you go, everyone. It's the end of a very long day. So GPM pregnancies supporting less than 36 weeks and over 36 weeks being really supported by the hospital. Okay, quarantine and isolation. So just when we got used to 14 days, we're going back to 10 days. So this is, again, a change that was announced by the Acting Chief Health Officer last Thursday. So people are released from 10 days post the date of their positive test. And if you're a household contact, 7 days from the diagnosis of first case in household. And if you're unvaccinated, 14 days from the diagnosis of first date in household. And other situations, workplace, school education, social contact have been just until negative results. So this is going to reduce those longer periods in isolation, including for families who got stuck in cycles of rolling quarantine. One thing that it's important, it is from the date of positive test. And if, as that person's care provider, they tested late, so say they tested on day 6 or 7 of their illness, you can actually write an email to the Western Public Health Unit and just document their date of symptom onset, and they will actually revise that release date. I don't think I need to say